Welcome to my channel, RX Sam 2020. Today we discuss a drug named Clotrimazole. About Clotrimazole is an antifungal medication. It is used to treat vaginal yeast infections, oral thrush, diaper rash, tinea versicolor, and types of ringworm including athlete's foot and jock itch. It can be taken by mouth or applied as a cream to the skin or in the vagina. Topical clotrimazole is usually not effective in the treatment of fungal infections of the scalp or nails. Medical use: oropharyngeal candidiasis, fungal otitis externa, skin fungal infections, vulvovaginal candidiasis, candidal balanitis. What is oropharyngeal candidiasis? Candidiasis in the mouth and throat is also called thrush or oropharyngeal candidiasis. Candidiasis in the esophagus, the tube that connects the throat to the stomach, is called esophageal candidiasis or candida esophagitis. Esophageal candidiasis is one of the most common infections in people living with HIV or AIDS. Fungal otitis externa. Malignant otitis externa, MOE, also called necrotizing otitis externa, is a serious infection of the external ear and temporal bone. Elderly patients with diabetes are typically affected by the disease. Pseudomonas aeruginosa. Pseudomonas aeruginosa is a gram-negative, aerobic, non-spore forming rod that is capable of causing a variety of infections in both immunocompetent and immunocompromised hosts. PSA is the causative pathogen in 50% to 90% of the patients. Candida balanitis. The most common cause of balanitis is related to inadequate personal hygiene in uncircumcised males. Of cases with identifiable causes, candidal infection is the most common. Various other infectious agents, dermatologic conditions, and premalignant conditions have associations with balanitis. Vulvovaginal candidiasis. Vaginal yeast infection, also known as candidal vulvovaginitis and vaginal thrush, is the excessive growth of yeast in the vagina that results in irritation. The most common symptom is vaginal itching, which may be severe. Other symptoms include burning with urination, a thick, white vaginal discharge that typically does not smell bad, pain during sex, and redness around the vagina. Symptoms often worsen just before a woman's period. Contra-indications: hypersensitivity. Special precautions. Pregnancy. Topical clotrimazole is categorized as pregnancy category B. Small amounts of clotrimazole may be absorbed systemically following topical and vaginal administration. However, topical clotrimazole is still considered safe to use to treat yeast infections in pregnant women and is a safer alternative to other antifungals. Vaginal: patient who has had greater than 2 infections of candidal vaginitis for the past 6 months, history of sexually transmitted diseases or exposure to partner with sexually transmitted diseases, irregular or abnormal bleeding, vaginal ulcers, diarrhea, dysuria or lower abdominal pain, fever, or chills. Not indicated for systemic fungal infection, oral. Hepatic impairment. Children. Pregnancy and lactation. Patient counseling vaginal may damage and decrease the effectiveness of latex contraceptives, for example, condoms, diaphragms. Use alternative contraceptive measures. Avoid the use of tampons, intravaginal douches, spermicides, or other vaginal products. Topical: avoid the use of occlusive wrappings or dressings, contact with eyes and mucous membranes. Monitoring parameters: monitor liver function tests periodically during therapy. Consider a potassium hydroxide test for diagnosing a fungal infection of the skin or culture prior to treatment to confirm oropharyngeal candidiasis. Monitor for severe skin irritation, for example redness, itching, burning, blistering, swelling, oozing. For eardrop, perforated tympanic membrane, a hole or tear in the thin tissue that separates the ear canal from the middle ear, eardrum. Side effects: clotrimazole cream, spray, or solution can sometimes cause irritated or red skin, or pain, or a burning or stinging feeling when you put it on. In rare cases, it's possible to have a serious allergic reaction, anaphylaxis, to clotrimazole. Drug interactions may diminish the therapeutic effects of progesterone, may increase the serum concentrations of sirolimus, tacrolimus, aripiprazole, dofetilide, lomatapide, neratinib, nimodipine, pimozide. Warning: keep this medicine away from the eyes or not for ophthalmic use. Frequently asked questions. Does clotrimazole cream kill bacteria? Clotrimazole is an antifungal medication. It kills and stops the growth of the fungi by destroying their cell membrane, thereby treating your skin infection. Brand names that are mostly prescribed by doctors: Lotrimin, Candid, Canesten. Dosage: oral, oropharyngeal candidiasis, adult, as 10 mg lozenges. Treatment: dissolve 1 lozenge slowly in the mouth 5 times daily for 14 days. As prophylaxis for immunocompromised patients undergoing chemotherapy, radiotherapy, or steroid therapy, 1 lozenge 3 times a day for the duration of chemotherapy or until steroids are reduced to maintenance levels. Child greater than or equal to 3 years as 10 mg lozenges. Treatment same as adult dose. Otic oral. Fungal otitis externa. Adult as 1% solution. Instill 2 to 3 drops onto the affected ear or ears 2 times a day or 3 times a day for at least 2 weeks to prevent relapse. Topical or cutaneous. Skin fungal infections. Adult as 1% cream, lotion, solution, apply thinly onto the affected area or areas 2 times a day or 3 times a day. Continue treatment for at least 4 weeks, dermatophyte infections, or at least 2 weeks, candida infections. Topical or cutaneous. Candidal balanitis. Adult as 1% or 2% cream, apply 2 times a day or 3 times a day onto the male sexual partner's genital organ for up to 2 weeks. Vaginal. Vulvovaginal candidiasis. Adult as pessary, insert 100 mg daily for 6 days or 200 mg daily for 3 days or 500 mg as a single dose. As 10% cream, insert 5 g, 1 applicator full, intravaginally as a single dose. All doses are inserted as high as possible intravaginally, preferably at night, using the applicator provided. Treatment may be repeated once if necessary and should be finished before the onset of menstruation. As 1% or 2% cream, apply thinly 2 times a day or 3 times a day onto the external anogenital area for at least 2 weeks, candida infections. Vaginal. Vulvovaginal candidiasis. Child greater than 16 years as pessary, insert 100 mg daily for 6 days or 200 mg daily for 3 days. As 10% cream, same as adult dose. All doses are inserted as high as possible intravaginally, preferably at night, using the applicator provided. Treatment may be repeated once if necessary and should be finished before the onset of menstruation. Combinations. Clotrimazole and betamethasone topical combination is used to treat fungus infections. Clotrimazole works by killing the fungus or preventing its growth. Betamethasone, a corticosteroid, cortisone-like medicine or steroid, is used to help relieve redness, swelling, itching, and another discomfort of fungus infections. Mechanism of action. Clotrimazole exerts its action primarily by damaging the permeability barrier in the fungal cytoplasmic membrane. Clotrimazole thereby inhibits the biosynthesis of ergosterol in a concentration-dependent manner by inhibiting the demethylation of 14-alpha-lanosterol. When ergosterol synthesis becomes inhibited, the cell can no longer construct an intact and functional cell membrane. Ergosterol also directly promotes the growth of fungal cells in a hormone-like fashion. Therefore, the rapid onset of the above events leads to a dose-dependent inhibition of fungal growth. Though clotrimazole exerts its antifungal action by decreasing ergosterol biosynthesis, clotrimazole exerts other pharmacological actions. These include the inhibition of sarcoplasmic reticulum Ca2 ATPase, depletion of intracellular calcium, and blocking of calcium-dependent potassium channels and voltage-dependent calcium channels. Such action of clotrimazole on different cell targets accounts for other effects of this drug that are separate from its antimycotic activities. Thanks for watching. Please like and subscribe to my channel and click the bell icon to get video updates.